Hello, welcome. My name is Mark Blatstein. I'm the physician founder of Physician Pre-Sentence Report Service. My email, my phone number. Welcome to my brand new website. Today, I'm going to talk about, for those of you, it's going to be a small subset who have recently undergone either a hip or a knee prosthetic insert or replacement. I'm very familiar with this because I had one, and it wasn't before going into the prison. It was several years, actually maybe 10, 12 years later. But if you had a replacement and you're going into prison, you're going to see bunk beds. You don't want to be on an upper bunk because if you have a broken hip, you don't want to have that because guaranteed getting medical care in prison is not going to be what you're used to at home. So going into prison after a hip replacement, you want to be smart. And I'll do my best to help you along. Please visit my website. It's up here, pprsus.com. Let's get going. Prison is temporary, so I don't want you to do anything to injure yourself. It's even more important if you have any sort of surgery that you had done. If it's a joint replacement, finger, knee, ankle, if it's a hip replacement, shoulder replacement, some of them you don't want to climb ladders. You don't want to climb into your bed if it's an upper bunk, especially if it's a major joint replacement or you have an unstable gait or just older and you're unstable. My name is Mark Blatstein, and I've been where you are, and I'm here today to help you on your journey. With work, I was able to get my medical license back, reinstated, and my career. Preparation, though, for release, you should at least consider preparing for release because prison is temporary. I realize it's counterintuitive, but preparation, it's recommended that we try and begin before the pre-sentence interview. Now, I'm not practicing what I preach because I didn't know any of this until I was years after I was released. And I would have appreciated understanding a lot of this before my journey started. But if you can pay attention and just accept this on faith, it's a start in the right direction. You may do something completely different, but at least having a plan and a daily routine starting from the first day you arrive and understanding what to expect when you get there is a good start. I had no idea what to expect because prison is temporary. Eventually, as I said, you're going to go home. The people who work there, they're there 24/7, 365. COVID, no COVID. This includes a history of back, shoulder, foot pain treatment, pathology or surgery. If you had a ringing in your ears, tinnitus, or other medical conditions, if you're unsure, just call me. Easy phone number, 240-888-7778. For those of you who know bone-on-bone pain, you've had this for a long time and you're ready because that kind of pain, there's nothing that anyone can do. They'll try conservative treatments. They could try injections, pain medicine by mouth, different sorts of bracing. But if it's bone-on-bone pain, as seen on MRI, CT scan, or X-ray, there's nothing they can do. They may try PRP, injections, but it's not going to work. No one wakes up one morning and wants to be cut open and have surgery. But if you're at this point where it's literally bone rubbing on bone, cartilage in your joints, it acts kind of like brake pads in a car. So when you're through your brake pads, it's just steel on steel, and you know it by the time you're out of brake pads. And then encasing each joint it's like a grape sack. It's synovial fluid, and it helps the joint glide one bone over the other. But once you're out of cartilage, you're toast. I know this because several years back, I don't know, a couple of years ago, I had a hip replacement, and I did everything I could to avoid it. I thought I had everything, but I thought I had sciatica, hip problems, rather back problems. No, I was treating myself, which wasn't too smart. There are many different types of arthritis, but mostly they all result. These are the ones that result in bone disease. Osteoarthritis, the king of them. Osteoarthritis is a painful condition characterized by joint degeneration or breakdown. It primarily impacts the cartilage and has implication for the surrounding structures, including tendons, ligaments, and bone. Tendon attaches muscle to bone, ligament, bone to bone, and then the bone itself. Osteoarthritis happens when the cartilage that lines your joints is worn down or damaged, and your bones rub together, is what I said. When you use that joint, osteoarthritis stands as the most prevalent joint disease worldwide. What's the causes? Mainly it causes individuals over the age of 50. Okay, I'm like 70. However, it can also develop in younger people due to injury, fractures, dislocations, or tendon ligament damage, abnormal joint formation in the womb or childhood. Additionally, being overweight can increase stress on the joints, especially knees, and raise the risk of osteoarthritis. But do not let this stop you from getting the treatment, including the surgery, because once you have that, you'll be able to move around better. Now, if you don't move around, it may complicate your healing. But if you're able to get to move around and are active with your physician to try and get rid of your obesity, then there's a benefit here. Primary osteoarthritis is the most common form of arthritis, which develops in the joints over time, similar to car tires. They wear down from everyday wear and tear, like your shoes. Secondary arthritis happens when there's something directly damages one of your joints, enough to cause injury, trauma, damaging the cartilage, which is a protective shock absorber covering the bone in the joint. Like when we watch the Olympics and the skiers, and if they take a jump, that damage when they come down, especially if they don't come down correctly, can really cause problems in their knees or hips. Other causes: sports injuries, falls, car accidents, health conditions that affect your joints like Ehlers-Danlos syndrome, joint hypermobility syndrome. Osteoarthritis versus rheumatoid. Unlike rheumatoid arthritis is a chronic disease of the immune system that causes inflammation of the joint when the tissues lining the joints are recognized as foreign. Sometimes both rheumatoid arthritis and osteoarthritis can be seen in the same joint. Most commonly affected joints: ankles, basal joint at the bottom of the thumb, feet, hips, knees, lower back, lumbar spine, neck, cervical spine. All surgeries have complications. So don't make your life more difficult for yourself. If you know that you just had a surgery, even if it's not a bone surgery, take care of yourself when you go into prison, and go in with a comprehensive uh, documentation for your pre-sentence interview. If it's not there, you're not going to get the best care ever in prison to start. If it's not there, you're starting off like in a third world country. But joint instability, stiffness, and implant wear and tear. In prison, recognize that you're going to a place you don't have any control. You do not want an upper bunk. If you have muscle weakness, an unstable gait due to degenerative joint disease, sciatica, neuritis, are older, or have other medical conditions that could contribute to an unstable equilibrium, your medical chart that you're bringing from home, that needs to be very clear. Your pre-sentence report should provide documentation from your surgeon, family practitioner, internal medicine doctor, or other physician stating that the top bunk is out of the question and why. You do not want to fall because getting medical care inside is not like you used to. Expect not to have specialty medical care provided. And even if you have that second opinion, which could take 2 to 3 years, your prison facility's clinical director is not obligated to follow that specialist's recommendations. This is just one more reason why a comprehensive pre-sentence report is essential and provided to your probation officer 10 days before you meet. It's critical. Consider it similar to getting insurance: life insurance, health insurance, homeowners insurance, car insurance. You hope you don't need it until you do, because it provides a baseline to the prison. Caveat: you've done everything to get all your medical care before you surrender, but you don't have the time for the surgery. You need the surgery, but your sentencing day is coming. All is not lost. Strategic planning begins with your surgeon and your attorney. Get your medical records written so the judge, the court, and the BOP will all act as your advocates. It's a very big thing. Make sure your pre-sentence report reflects all of the medical records, including all of the conservative care you've already done and the surgical planning already done by your orthopedic surgeons and what they plan on doing, and why without it, your quality of life will be severely affected. And what you need to do is present all of this very detailed, organized, not complicated, to the probation officer. The first person that you meet is going to be the most important person in your life, and that is the probation officer writing your report. Why? That's because if you can get them to believe in you and to become your advocate, because they see a lot of people every day, by giving all the information to them in advance, and they become your advocate, then they can make your case for you to the judge, because the judges depend on them. Then pre-plan with counsel before the pre-sentence interview that your first placement request is at a specific federal medical center to get your procedure. And then where you'd like to spend the rest of your sentence, supported with reasons why you've picked that facility. The reasons may be best based on available programming, medical care, location, etc. So I provide prison placement packets based on these 2 items so that you know exactly what you need. So we're going to go into them. Hip replacements. These fractures are very painful and you can't walk or stand. You need to go to the emergency room. Doctors will check your leg. They may take x-rays, CT scan. They may admit you to the hospital, send you to another one that treats this injury. They may test your head and heart to see if you hurt elsewhere. A periprosthetic hip fracture refers to a broken bone around a hip replacement, like this particular x-ray. This can occur during the surgery or as the result of a fall or accident. The fracture typically occurs in the thigh bone near the metal stem, right here. In some cases, the bone near the hip and socket may also break. This is on the outside, where you have fractures that cause intense pain, and it makes it impossible to walk or stand. It's crucial to seek urgent medical care at the emergency room. Their doctors will carefully assess your leg, possibly perform an x-rays, again, CT scan, get a detailed view of the injury. Depending on the severity of the fractures, here are several, they may decide to admit you to the hospital, transfer you to a specialized medical center for further treatment. In addition to focusing on your leg, medical professionals may conduct tests to check for any potential injuries to your head or heart. But you're in prison. It may not be seen by a specialist for weeks, months, or possibly years. Prevention is your friend. What tests are done to diagnose osteoarthritis? In prison, there are no guarantees regarding a specialist's second opinion, diagnostic testing, following the ordered test, or implementing their specialist's recommendations. On the outside, your healthcare provider might use x-rays to take pictures of your joints. They might also use an MRI, magnetic resonance imaging, or CT scan. You might need blood tests to rule out the conditions or issues that cause similar symptoms. Knee replacements. As in all joint replacement procedures, pain comes from bone rubbing on bone, and there are only so many conservative ways to treat this pathology. Eventually, the patient decides that they're ready to take the next step. This is an x-ray of the knee, and you see pictures of bone on bone, no cartilage. In the knee, bone on bone looks like this picture. What causes knee replacements to fail? The primary causes of a knee implant failure are wearing and loosening of the implant, infection, instability, leg fraction, or stiffness. Here are multiple examples of why the implant should fail. So all these examples here, you can go to my website and look up. But the reason I have them all here is that you need to be very careful. If you have a knee implant, there are many more ways for this to fail than a hip implant. A hip implant is just one long stem and a ball. A long stem goes into your femur. Here, these are very small pieces and they can dislocate very easily, which I'm going to show you. Any type of revision procedure, I don't care whether it's in bone or it's a soft tissue procedure, they're always more difficult because when you initially do a surgical procedure, all of the soft tissue moves apart in planes. And so it moves apart naturally. The minute a doctor has or a surgeon has to go in and revive something or do a revision or fix another doctor's procedure or an accident, there's a lot of scarring. And so these are not natural tissue planes. So revision surgical procedures are more complicated, which is another reason to know your limitations. Here's a prosthetic implant dislocation. In the left, you can see the knee completely dislocated. You're not going to get this fixed that fast in prison. Maybe, but I wouldn't, I'm not going to place a bet on this in Las Vegas. Then it was corrected by a specialist on the right-hand side where they were able to dislocate the joint. You're not going to get the anesthesia you need to pull that back into place. This is a very painful procedure. And so I hope that you found this all helpful and being careful you need a bottom bunk. You can go play some sports. Don't be crazy. You're going to go home. Concentrate on maybe something that you can do once you're leaving. If you're going to retire, great. Are you going to volunteer? Are you going to care for a loved one? But don't screw up your surgery. If you're going in with a hip or knee replacement, shoulder replacement, know your limitations. Those old Clint Eastwood movies are true, kind of. He pulls the gun and he says, everybody's got to know their limitation, and then he kills the guy. So I appreciate you taking the time to listen. I hope you have a great day and you found this helpful. It'll all be available on the website and through this YouTube. Again, thank you for listening.